Hello, my name is Jasmine Ojeda, and today I'm going to discuss a critical issue that affects millions worldwide, but specifically depression and its profound influence on the female gender. What is depression? Depression is a complex mental health disorder that impacts emotions, thoughts, and daily life. Persistent sadness, hopelessness, and the loss of interest in once enjoyed activities are all hallmarks of depression. A person's energy levels, focus, appetite, and sleep patterns are all impacted, and in extreme situations, it may even trigger suicidal thoughts. While it affects both men and women, research consistently shows that women are diagnosed with depression at nearly twice the rate of men. This gap is not merely a matter of biology. It is shaped by the combination of genetic, hormonal, and psychological and social cultural factors. The prevalence of depression varies by nation, yet most depressed women are the same in most countries. Data collected has showed that about 10.4% of adult women in the US are more likely to have at least one major depressive episode each year, compared to 5.5% of males, meaning 1 in 8 women experience depression in their lifetime. The childbearing years are the peak age. According to Dr. Paul Albert, major depression is already the main cause of illness among women worldwide and is expected to become the leading cause by 2030, contributing to the overall disease burden in Canada and all around the world. Although the higher rate of depression in women may be influenced by variations of socio-economic circumstances, income, and education, biological factors can be empirically traced back to the diagnosis of depression in women. Depression in women is influenced by biological and hormonal changes throughout their lives. Fluctuations in estrogen and progesterone during menstruation, pregnancy, and menopause can significantly impact mood regulation. Research indicates that hormonal imbalances can contribute to increased vulnerability to depression, particularly during postpartum periods and perimenopause. According to Weissman and Olfson, about 10% of pregnant women in the US will meet diagnostic criteria for major depression. Women may be more susceptible to depression due to variations in brain chemistry, specifically in the way serotonin is metabolized in their brains. Research conducted by Maria Di Benedetto showed that women may be more vulnerable to the negative consequences of long-term stress and mental discomfort because of hormonal differences that cause them to have an elevated stress response. Systemic racism has a major impact on depression in women, especially women of color. Racism has profound psychological and physiological repercussions that lead to inequities in mental health. It is not merely an exterior social problem. Because of prejudice, economic disparity, and restricted access to high-quality health care, women from marginalized racial and ethnic backgrounds frequently endure chronic stress. According to Chantel Martin, being exposed to racism raises one's chances of anxiety, depression, and other mental health issues. Feelings of pessimism and despair can result from the ongoing stress of navigating a culture where racial inequality affects housing, employment, education, and even medical care. Depression is also significantly influenced by family history. Women are more likely to have depression or other mental health issues themselves if they have a family history of the condition. Certain people are more susceptible to mood disorders due to genetic influences on the brain's processing of stress and emotions. But family history is not solely based on genetics. Depression can also arise because of environmental influences. A woman's perception of emotions, coping strategies, and resilience may be influenced by her upbringing in a home with mental health concerns. Depression is not just a result of biological factors. Psychological influences also play a significant role in its development and persistence. Negative thought patterns, the experiences female veterans face, and the trauma of domestic abuse all significantly impact mental health. These factors can create a cycle of emotional distress that is difficult to break without intervention and support. Women who serve in the military are subjected to stressful situations, traumatic events, and prolonged separation from their support networks. Many female veterans have difficulty reintegrating into civilian life, finding work, and mending relationships after returning home. Military sexual trauma, which has been closely associated with anxiety, PTSD, and depression, is another issue that women in the military are more likely to encounter. According to Holly Searsing, due to the stigma associated with mental health in military culture and the dearth of appropriate mental health supports, female veterans frequently struggle with depression in secret. Another important psychological component that affects women's depression is domestic abuse. Chronic tension, anxiety, and depression symptoms are frequently experienced by women who are abused emotionally, physically, or sexually in their relationships. Domestic abuse has a lasting psychological impact on survivors who may experience post-traumatic stress disorder, low self-esteem, and feelings of terror. Because of their financial reliance, social pressure, or concerns for their safety, many women in abusive relationships feel stuck. This helplessness exacerbates the consequences of depression and adds to long-term mental anguish. Societal pressures play a crucial role in depression among women. Gender roles, workplace discrimination, and the burden of unpaid labor often contribute to chronic stress and emotional distress. Women in lower socioeconomic groups may face additional struggles due to limited access to resources and support systems. Societal expectations can intensify feelings of discomfort and loneliness. Women are disproportionately burdened by gender stereotypes, the stigma associated with mental health, and the difficulties of parenting, all of which make them more susceptible to depression. Women frequently find it more difficult to identify their difficulties, ask for assistance, and get the support they require because of those social issues. Even at the price of their own well-being, women are frequently expected to be selfless, loving, and emotionally strong. The concept that expressing feelings like melancholy and irritation is a sign of weakness is also reinforced by gender stereotypes, which can keep women from talking freely about their mental health issues. Chronic stress, burnout, and the depressive symptoms are further exacerbated by workplace discrimination, unequal pay, and the expectation that women must balance many responsibilities, including those of caretakers, professionals, and homemakers. Although motherhood is sometimes portrayed as a happy, rewarding experience, for many women it may also be a major source of stress and despair. Hormonal changes, fatigue, and a great deal of social pressure to be the ideal parent only add to this mental battle. Many new mothers suffer from postpartum depression, although it is frequently misdiagnosed or disregarded. Because of its cultural expectations, women with PPD may experience tremendous feelings of grief, guilt, or worry, but they may be reluctant to express these emotions for fear of being viewed as unfit mothers. Depressive symptoms are further exacerbated by inadequate maternity leave, financial strain, and the difficulty of juggling work and child care obligations. Impact of depression on women's health. Women's physical health and general well-being are significantly impacted by depression. Postpartum mothers, those with chronic illnesses, and people who suffer from severe and ongoing depression are some of the most vulnerable categories. Since there is no denying the connection between mental and physical health, depression must be treated as a whole problem rather than as a separate psychiatric disorder. On the other hand, depression itself can exacerbate chronic conditions by causing inflammation, impairing immunity, and resulting in unhealthy lifestyle choices like poor eating, inactivity, and non-adherence to medications. Postpartum depression strikes women in the weeks or months after giving birth. Postpartum depression is more than just the baby blues. Even while hormonal changes, sleep deprivation, and new parenting obligations all contribute to normal mood swings, strong emotions of grief, worry, guilt, and emotional distance from their child are common among women with PPD. The growth of the infant is also impacted by this illness, as depressed women may find it difficult to connect with their kid, meet their requirements, or keep up a regular caregiving schedule. Women are more likely to try suicide, frequently as a last resort to get away from emotional suffering. Although men tend to die by suicide at higher rates, untreated depression, unresolved trauma, social expectations, and a lack of mental health resources can all drive women over the edge. Postpartum women, victims of domestic violence, female veterans, and people with chronic pain or sickness are among the most vulnerable. Now I will talk about the effectiveness of cognitive behavioral therapy, as it is one of the best recommended therapies for depression. Cognitive behavioral therapy is a type of psychotherapy that helps people manage their mental health by changing their thoughts and behaviors. CBT has been proven to be one of the most effective psychotherapeutic treatments for depression. It helps individuals identify negative thought patterns and develop healthier coping strategies. Studies suggest that women who undergo CBT show significant improvements in managing depression-related symptoms. Another form of effective therapy is interpersonal therapy. Interpersonal therapy is a brief, empirically supported psychotherapy that aims to reduce mental health symptoms by enhancing interpersonal interactions. It works especially well to care for depression. IPT examines interpersonal relationships, whereas CBT assists in altering thought habits. Now I will be discussing the pharmacological treatments. Selective serotonin reinhibitors are common first-line treatment for depression. They can be effective for treating moderate to severe depression, but the benefits are modest and less pronounced for mild depression. Antidepressant medications such as SSRIs or SNRIs are commonly prescribed for depression. While effective, these treatments must be carefully monitored due to potential side effects, including weight gain, decreased libido, and emotional numbness. These medications address neurotransmitter abnormalities such as those in serotonin and norepinephrine, which are linked to mood disorders. Now I'm going to talk about holistic approaches. Holistic treatments like yoga, meditation, and exercise have gained recognition as complementary therapies for depression. Yoga and meditation help regulate stress hormones and improve mood, while lifestyle modifications such as a balanced diet and sleep hygiene can also contribute to long-term well-being. Masume Shohani conducted a comprehensive study on the impact of yoga and numerous mental health conditions, emphasizing the practice's therapeutic potential. Yoga techniques such as breathing exercises and meditation can help reduce stress and anxiety, which are common triggers for depression. Yoga encourages mindfulness, which involves being present in the moment and expecting thoughts and feelings without judgment. This can help improve coping mechanisms and reduce negative thought patterns. Community-based interventions. Jean Marie Stasserini conducted research in 2008 on a group of Puerto Rican women to identify if community-based interventions would be successful to those struggling with depression. The study included focus groups to examine the impact of community-based interventions, providing a platform for women to share their experiences, establish support systems, and access culturally relevant resources. According to Stasserini, one of the primary benefits of these initiatives was the reduction of social isolation, which often exacerbates depressive symptoms among minority groups. The group's promotion of open discussion and understanding made participants feel less stigmatized and more validated in their mental health concerns. Barriers to treatment. Despite the availability of treatment, many women face significant obstacles in accessing appropriate care. Personal, systemic, and societal barriers affect access to treatment. Personal barriers. Fears of stigma, self-doubt, and misconceptions about depression often prevent women from seeking professional help. Some may feel obligated to prioritize family responsibilities over their mental well-being. Research by Tanya Gregory indicates that internalized stigma prevents many women from disclosing their depressive symptoms, delaying their access to help. Feelings of guilt or self-blame deter women from prioritizing their mental health as they are afraid to show weakness. This issue is even worse for single moms, who often have competing financial concerns that keep them from seeking mental health treatment. Systemic barriers. Healthcare disparities, lack of insurance coverage, and insufficient mental health services create systemic barriers to treatment. In many areas, particularly rural communities, access to qualified mental health professionals is limited. Systemic issues in healthcare systems further limit access to therapy. There is a shortage of mental health practitioners in many nations, particularly those who have received training in gender-sensitive care. By posing obstacles to receiving mental health care, such as shortage of doctors, transportation issues, and poverty, have a substantial influence on the treatment of depression. Societal barriers. Cultural stigma surrounding mental illnesses contribute to the reluctance to seek help. Many societies still view depression as a weakness rather than a legitimate health concern, further discouraging women from pursuing treatment. Social norms and expectations significantly restrict women's access to treatment. Traditional gender conventions often position women as the primary caregivers, leaving them with less time and energy to focus on their own health. In certain culture contexts, mental health issues are taboo, which prevents open communication and perpetuates cycles of silence and neglect. Prevention strategies. Promoting mental health education, increasing awareness about early intervention, and fostering supportive communities are crucial to preventing depression. Workplace policies that accommodate mental health needs can also help mitigate stressors contributing to depression. In addition to educational programs, online resources and community workshops can raise awareness of depression signs and encourage early intervention. Implementing education initiatives that help fight stigma and promote the normalcy of seeking mental health care empowers women to prioritize their mental health. Additionally, encouraging balanced diets rich in nutrients, including omega-3 fatty acids and B vitamins, support brain health and emotional stability. Getting adequate sleep and using stress reduction techniques like mindfulness and relaxation are also essential. Women who use these tactics report improved resilience in the face of hardships and improved mood regulation. Future research opportunities. Future research is needed to understand gender-specific responses to depression treatments. Investigate the role of hormonal fluctuations, genetic predispositions, and alternative therapies could enhance personalized treatment plans for women. Young Women and Girls Convention from early mental health, education programs that teach coping mechanisms, emotional regulation, and stress management skills are just some of the ways we as a community can help. Peer-supported groups, mothers' clubs, and mentoring programs are examples of initiatives that can reduce loneliness and provide emotional support, establishing and sustaining networks of support. Lifestyle modifications and prioritizing physical health can postpone the onset of depression by promoting overall well-being. Impact of untreated depression. When left untreated, depression can lead to severe consequences, including suicidal ideation, substance abuse, and increased risk of developing chronic illnesses. Persistent depression increases the risk of diabetes, hypertension, and cardiovascular diseases, and because of its physiological effects, it causes inflammation and hormone dysregulation. The societal cost of untreated depression is also significant, leading to the loss of productivity, and increased healthcare expenditures. The most alarming is the link between untreated depression and its increase of suicide and self-harm. In conclusion, depression in women is a complex issue influenced by biological, social, and systematic factors. Addressing these challenges requires a multifaceted approach that includes effective treatments, reducing barriers to care, and fostering a supportive societal environment. Future research and policy improvements can ensure that women receive the care they need to live a healthier and more fulfilling life.